Dr. Chris Rademacher. Chris is the swine extension veterinarian at Iowa State, and today has kind of an update on topics in the swine health area.
All right, Jamie, thank you very much. All right, we'll go ahead and get started here. What we'll try to talk about today, a couple of health topics, and then maybe a couple of lessons learned from the supply chain disruption as it deals with foreign animal disease preparation. So we're going to talk a little bit about PRRS. It was a fairly active PRRS season, and a new strain kind of developed or emerged, if you'd want to say it that way. So we'll talk a little bit with what we saw, what we've learned, where it's at, things like that. The other thing we'll talk a little bit more is just about some vesicles on market pigs that we're noticing just real recent here within the last couple of weeks at the diagnostic lab at Iowa State. So we'll talk a little bit about that. Then we'll spend some time talking about COVID-19 supply chain disruptions and some things that we learned about some depopulation methods and disposal methods along with that. So the first thing that we're going to look at here is I'll give a shout out to a couple of my colleagues that work up in VD-PAM at the College of Vet Med, Dr. Lynn Harris and Dr. Giovanni Trevason. They were able to put this together. It's called the Swine Disease Reporting System. This is publicly available. So this is information. If you look there across the bottom, you can go ahead and log into that website and look at this in real time. What it does is it takes diagnostic disease testing information from Iowa State, Kansas State, South Dakota State, and the University of Minnesota and aggregates it into one dashboard to just kind of see, looking for seasonal type trends, looking at different pathogens over different times of the year, just kind of see what the industry, a snapshot of what the industry might be seeing from a swine disease standpoint. So what you see there across the bottom is the last 3 years, and the numbers there represents the week of the year for each of those years. That red line there, that's the percent positive. So a percent positive would be if I send in 100 samples, 30 of them will be positive. That's 30% positive. So you can kind of see that's the rate that they're looking at over there. If you look under 2020 there, then what they have is kind of the 95% confidence interval. So that would, you'd say, most of the time that would just be considered normal variation if that red line stays within that blue line area, in which you can see there for starting into the fall, September, October, November, December of 2020, we can see that the percent positive start to exceed kind of what you consider to be normal variation, right? So indicating that we were starting to see a challenge with PRRS. And then along with that, that dashboard also looks at different PRRS RFLP typing. So RFLP typing is really just kind of a way to classify viruses. I would say that there's still a lot of variation within those RFLPs. So you could have two 1-4-4 strains that could still be 10 to 15% different when they look at all 600 base pairs of the nucleotide when they do the sequencing. But certainly that's what we were seeing here, mostly in Minnesota and in Iowa. We were seeing an uptick in PRRS cases of that particular RFLP typing. So along with that, the Swine Health Information Center was able to put on a webinar here for veterinarians a couple of weeks ago to kind of talk with what they were seeing with these 1-4-4 strain. So they had a couple of guest veterinarians and they had some researchers that were looking more deeply at this PRRS virus. So kind of what they found, or what the summary of that would be, is it looks like other PRRS strains, it just was a whole lot worse than maybe what we've seen typically in the past. So what were some of the things that they were seeing? Generally, they said when it would come into an area, it would generally hit the growing pigs first and then eventually get into the sow farms. And when it hit the growing pigs, they saw a lot of really high mortality. So anywhere from 15 to 30% of the or kind of herd losses in that couple of week outbreak time period. And it wouldn't matter if they were wean pigs, feeder pigs, or even up to market pigs. Typically in the past, we have modified live vaccine strains that we go ahead and use the vaccines to kind of help deaden the effects of lateral infections of PRRS virus. And for the most part, generally what we've learned is they won't prevent the pigs from getting infected, but they do limit the losses. And at least with this strain, the early reports from the veterinarians is it didn't really seem to matter whether they were vaccinated or not. They were still seeing really high mortality. The virus would kind of be characterized by really high fevers, poor responses to treatment. And then the other thing that was is that lateral infections were common. So it would maybe come into one finishing site with one producer, and before you knew it, it was starting to affect neighboring sites that had no connections between that and the initial site. So lots of lateral movement of this virus. One other thing that they noticed when they were testing these pigs, the PCR test will tell you whether it's positive or negative, but it's also somewhat quantitative in that you can look at the CT value that we report is kind of an indirect evidence of how much virus is there. And generally with those, it's an inverse relationship. So the lower the CT value means the higher amounts of virus. So with these strains that were in the sow farms and the growing herds, they would see very low CTs, which would indicate a lot of virus. And sometimes with viruses, if we have a lot of virus, that means there's more virus out in the environment to potentially infect other pigs. So that was something that was just seen. Lots of movement of the virus between sites and really low CT values or just a lot of virus in the area. In the breeding herds, it was a pretty predictable pattern to what they would see. It would generally start with maybe just a handful of sows that would be off feed and gestation. And by the very next day, there would be hundreds of animals that would be off feed. It was not uncommon at all between abortions, sow mortality, pre-wean mortality, that these farms would go between 4 to 7 weeks where they wouldn't wean a pig off the farm. And which is maybe more characteristic of maybe more of the recent viruses that we're starting to see than maybe what we did even 5, 6 years ago, is extremely high sow mortality as well. So during these outbreaks, a farm could lose 10 to 20% of their total inventory and just in sow mortality over that couple week time period. So a little bit like the growing herds, typically in the past, if a producer goes through and is able to clean their herd up, maybe even start it from a completely clean and naive herd, when those herds get infected with PRRS, that's usually when we would hear about some of the worst outbreaks. Now, if we get a new strain into a farm that maybe already had a strain or was vaccinated or had a previous strain and was vaccinated, we would have an outbreak, but maybe it wouldn't be as bad. Well, early reports from this is it didn't really appear to matter whether they were vaccinated, whether they had a previous infection, or whether they were truly naive. The outbreaks typically were all the same. And the other thing that they noted too is, they saw PRRS in sites that had remained negative and had outlasted other previous outbreaks where they were able to keep it out, that they would start finding it in, this strain would seem to find its way into those herds as well. So just kind of a really bad type of PRRS season from that standpoint. Just sharing some additional research from Drs. Holtkamp and Linhares, just looking at biosecurity, some research that they've done, and just due to time, I just snipped this one picture out. They're working on a bunch of additional studies, looking at potential areas to keep an eye out for, ones that may potentially contribute to a PRRS outbreak. So they looked at 19 cases between 2015 and 2018, and they just looked at risky behavior. They couldn't really say in any of those cases what exactly the cause was, but they were trying to look at, things that they noted on those farms in and around that time that could be somewhat risky from a biosecurity standpoint. So in that case, they looked at a whole bunch of different causes and then assigned different risk values to them. And the ones that they saw, at least in that small outbreak, collection of outbreak investigations, is that some of the behavior by on-farm employees, how often, how they were handling and managing their cull sows, and then bringing in outside repair people to do work in the barns were some of the riskier behaviors. So really from a PRRS standpoint, biosecurity is probably still one of our biggest weapons. And we just need to continue to look at that, make sure when we're visiting farms that we're looking, making sure everybody's doing what they're supposed to be doing inspection, doing audits, things like that. So moving on from PRRS to talk a little bit about vesicular disease and market pigs. So this is more of a recent development here at least cases that were coming into Iowa State, where we just saw this kind of rash outbreak of pigs with vesicles on their nose and snout and mouth over the past couple of weeks, including at least one case at a packing plant where they had to shut the lines down and get the pigs dealt with. Can anybody tell me why this would create concern? I would tell you none of these pigs were sick. They were completely clinically normal. vesicles make people nervous, or why would they shut a packing plant down? Yeah, foreign animal disease, specifically foot and mouth disease. That's the thing that's most important here. So here's a collection of pictures of pig snouts with vesicles on it. And that's the issue, right? Foot and mouth disease is clinically indistinguishable from Seneca virus, which was probably what we see more typically here over the past 5 to 6 years. You couldn't look at that picture and say, yeah, that one in the top middle, that's definitely foot and mouth disease, and the one below it, Seneca virus. You just can't tell. So we just need to continue to be diligent to make sure that we're alerting people when we see this, certainly because of that risk, right? We want to make sure that we're investigating those and that confirming they're not foot and mouth disease. So here's some data. Once again, there in the upper left, that box there is the conglomeration of the 4 diagnostic labs, what they've seen over the years. And then the box in the lower right-hand corner is just some internal data we collect at Iowa State University. What we see is typically Seneca virus tends to be more of a summertime distribution, the summer and fall. So to have kind of a rash of cases with vesicular disease in December and January is generally somewhat abnormal. So like I say, those pigs aren't sick, but they create concerns about making sure, we want to make sure we confirm it's not a foreign animal disease, foot and mouth disease in particular. And you can see, up until we saw kind of an increased prevalence with a newer strain that seemed to be introduced in the summer of 2015, you can see that the foreign animal disease investigations, this is some data from USDA, generally there were just a handful each year, but then you can see it steadily increased from 2015 to 2019. And almost all these foreign animal disease investigations are due to vesicles being reported on the snouts or around the coronary bands of the feet. So that's part of the ask here today, is just to make sure, and this recently has been just with market pigs. So the message is, hey, if you're out there working in your pigs, they're getting ready to be marketed, you're going out to mark them, or you're getting ready to load them, even though they may look perfectly healthy, make sure you're taking a look at their snouts while you're in there, because that's generally what we see. We want to make sure that if we do see that, we're contacting our veterinarian, and the veterinarian will work with the state and federal officials to make sure they get samples collected from them so we can send it off and verify that it's not foot and mouth disease. And they kind of generally determine the next course of action. Usually what they do is they'll send somebody out to collect samples. They'll just put a temporary quarantine on the site, generally for 24 to 48 hours, until they get the confirmation test back that it's not foot and mouth disease. We want to also make sure, even if you get that, you do that and you get the confirmation back, we don't want to sell those pigs with any of those active lesions. So we want to make sure we're giving those pigs some additional time and that those lesions are completely resolved. The other thing I would say is, if you are going to sell it from a site, you've had them tested, they're clean, the lesions are resolved, you may just want to go ahead and contact your packer and say, hey, we had a case here a couple of weeks ago, worked with our vet, got the clearance from the state and federal officials, and we waited for all the lesions to be resolved, but just heads up, just to make sure that what we're seeing. In 2015 and 16, we also saw some sow farms that were becoming infected. And in those cases, they wouldn't really see anything on the baby piglets. They would maybe find some lesions on the snout or feet. Once again, the sows wouldn't be sick. Somebody would have to be going out there and actively looking for it. The other thing that they might see is just an increase in pre-wean mortality of really young pigs less than 7 days. So really, just the key takeaway there is make sure you're looking for vesicular lesions. If you find them, let's make sure we're contacting a veterinarian and our state and federal officials. So I want to talk just a little bit about COVID disruption. I mean, obviously everybody felt the effects of that. I really wanted to give credit to Iowa Pork Producers Association and the Iowa Department of Ag and Land Stewardship, otherwise known as IDALS. As the packing plants were closing and market pigs were starting to back up, there really got to be questions for producers about what are we going to do with these pigs if we can't get them sold, right? So Iowa Pork Industry Center, along with IPPA and IDALS, went together jointly to form what was called the Iowa Resource Coordination Center, kind of a public-private partnership. We used an incident management team structure, which is what would happen if we had a foreign animal disease. And all members here, Matt and Cole, and they were involved as well as just kind of serving as liaison. So producers could go ahead, call into that hotline and say, hey, I've got this issue. Who can I talk to about it? And help try to answer any questions. So my sub team specifically was tasked with looking at depopulation and disposal options if it got to a point where we couldn't slow those pigs down anymore and we'd have to start depopulating. Now, thankfully, we didn't really have to do a whole lot of that because the plants did wind up open. Dr. Patience and his colleagues did some really fine work to show how to slow the growth down on those pigs. So thankfully, we didn't really have to utilize that. But we did have the opportunity to take a closer look at some of these options and help us be a little bit better prepared in case we ever do have a foreign animal disease. So veterinarians and producers would kind of work closely. The veterinary group, American Association of Swine Veterinarians, are working with the AVMA, which is the American Veterinary Medical Association, to kind of use this choice algorithm that you see listed here about how do we evaluate different depopulation options. So obviously, the most preferred ones are euthanasia options that we're doing for normal mortality today. So those are all kind of in that first preferred column. There are some that are permitted only in constrained circumstances. So constrained circumstances would be foreign animal disease outbreak, a natural disaster, or in this case, massive supply chain disruptions qualify as permitted in constrained circumstances. So veterinarians and producers, were active in several of these areas. The ones that we have highlighted there in red, there was a small group of us working through the Iowa Resource Coordination Center that got some money from USDA to investigate, well, how would we take the learnings from carbon dioxide that we typically get done on small pigs on sow farms? How could we apply that to market pigs if we had to go ahead and do that? And then the other one that we looked at a little bit closer was a mobile euthanasia trailer utilizing a pneumatic captive bolt gun. So we'll talk a little bit more about those here in the upcoming slides. So we had the ability to work with a producer who was concerned about having to do some depopulation. So they built a couple chambers here that you see, CO2 chambers on one site that they would go ahead and bring their market pigs to if they needed to do that. And then just, I'll show you a couple of different methods of getting the CO2 into the chambers, but real simple bays here. Each one of these, there's 2 of them on the site. Each one holds about a half of market load. And then you see the tarp that would be rolled over the top in order to keep, to kind of seal the chamber while we put CO2 in there. So here you just see some more pictures of the chamber. They're generally about 10 feet by 40 feet long, designed to hold about a half a market load. The first effort that we looked at was kind of replicating some work that was done by some ag engineers at North Carolina State utilizing the ag bag. So the CO2 comes in these really large liquid high pressure canisters. And they're the same canisters that get used in restaurants for fire suppression, okay? So we were able to figure out we can source those, but the problem is you can't get enough of those to run the gas fast enough. You couldn't just hook them up to a barn and turn the valves on and call it good, right? So you've got to take that high pressure liquid CO2 and you got to convert it to CO2 at room temperature. And then that gas is obviously, that liquid, and when it comes to gas, is going to expand. And we kind of need a temporary chamber to put that gas into to get it to room temperature before we take the gas and put it into the eventual chambers there. So the first one we did there, we did a slow fill of an ag bag there. So we had done that the night before. We were getting ready to do our evaluations. Well, you can see we had some fence posts there to try to keep it contained. Well, the wind picked up overnight, rolled that over the fence post and punctured that, right? So we had to kind of start from scratch there. But that was the thing we learned there, is say, well, that is kind of a nice temporary storage, but in Iowa with the winds we get here, that's probably not going to work long term. The other thing that we started to investigate, and where we're probably going to wind up and finish up at after some discussions with some colleagues at Pipestone, is using the thing there in the middle, which is kind of they call it an ambient air vaporizer, and really prominently used in the welding industry. So we're able to source some used ones for this evaluation. But you kind of think of it just as a really big radiator. Okay, so you can see those couple of 440 liter liquid CO2 tanks there. That, we just called up Praxair and they deliver them, generally within a week. So it hasn't been an issue of getting CO2. But then you take that high pressure liquid CO2 and you run it through that vaporizer, which warms it as it's going through there. And then instead of the ag bag, what we looked at doing is utilizing some old LP tanks. So we've got 4,000 gallon LP tanks that are all plumbed together. So generally what happens is it takes about 20 to 25 minutes to fill those LP tanks coming off those liquid CO2 tanks. We fill them up to about 50 to 60 pounds per square inch. And then once we get them filled, we go ahead and load the pigs into the chambers. And then we slowly feather in that gas from the LP tanks. So about 10 to 12 PSI per minute over a 5-minute period. We fill that chamber and then we let the CO2 in there for another 15 minutes after we fill it. And we did several runs of that. And every time we did it, we had 100% efficacy when we rolled that top back out, let the CO2 kind of dissipate, and then went in there and checked the animals. And it was certainly, it was 100% effective every time that we did it. So, and generally what we would do, we were trying to think about, well, how would you ramp it up? How fast could you do that? Generally, we figured, well, you'd kind of do a cycle, probably every 25 to 30 minutes. So you're probably only looking at 100 to 200 per hour that you could actually do. By the time you fill them, you fill the chambers, you let them dwell, you go ahead and confirm insensibility and death, and then generally take about 15 to 20 minutes for a skid steer with a grapple hook to get all those carcasses out of there and load it out. So, but very, very effective. Probably one of the more aesthetically depopulation methods that we have. Here is, so instead of stationary chambers, there was a group there that went ahead and applied the same technology of storing the CO2 at room temperature temporarily in the LP tanks, but then instead of those permanent structures, they actually just did some modifications to a gravel truck here, put a panel there in the back, put a false ceiling in on top so that they could walk on it and decrease the size of their chamber. And kind of the same story there. They would fill that over a 5-minute period. They'd load about 50 to 60 market pigs in there. And then they'd let them do that. After they filled it over 5 minutes, they'd let it sit another 15-minute dwell time. And then this was built on a hydraulic trailer. They would just go ahead at the end of that 20-minute time period, lift the hydraulic trailer and the carcasses would roll off. And then they would have skid loaders and payloaders there to go ahead and pick those animals up and dispose of them. So that was the CO2. The other one we looked at, a colleague of mine called me early on, as they were trying to scramble to think about ways of doing depopulation if we had to. And he had worked with a equipment supplier, had located some old retired V restrainers that were in packing plants when they used to electrical stun them and then stick them and bleed them out. Well, when they went to CO2, they didn't need those restrainers any longer. So there were some restrainers that were sitting in and a used lot there. So they had found somebody that had identified those. He had also found a fabricator who was willing to purchase those and then mount them on a trailer in order to make it mobile. And then one of my colleagues in the beef arena at Iowa State had a pneumatic captive bolt gun trailer that was already built that could be used to actually euthanize the animals. So we went ahead and through that USDA grant, we went ahead and built one of these trailers. So what you're looking at here is kind of the front end view of it. You've got right there in front, it's a hydraulic 7 horsepower hydraulic motor to run the V restrainer. You kind of see the V restrainer there in the middle. So we load the pigs kind of from the back end. I'll show you some more pictures here in a moment. They come down the V restrainer. They go to the pneumatic captive bolt gun, and then they just slide off that discharge chute either into a bucket or into a series of horizontal gravel conveyors to convey those carcasses away. So we were in the process of building it. Thankfully, we didn't really have to utilize it. We still wanted to test it out and make sure, look at any potential improvements that we had to make on it, which we did do it. And then we came back and did a second evaluation. And we just found a couple of producers who were willing to donate some blemish market pigs. So pigs with belly ruptures or belly busts or things like that to allow us to utilize that through this trailer. In the course of trying to figure that out, we knew that the V restrainer would do a good job of holding the pigs in there. The problem is with that pneumatic captive bolt gun, those pigs could still swing their heads around. And if you ever used a bolt gun before, you know, obviously In those cases, we usually snare them to make sure that we keep that head still so we get proper placement of that pneumatic captive bolt device. Well, that wasn't going to be as feasible here. So what we actually looked at is we made this a two-step process. So right in the middle there, you see is the first pigs as they kind of come about halfway down that trailer. We wound up purchasing an electrical stunner. So the electrical stun those pigs for about 8 seconds so that they're mobilized. So once he pulls that wand off, those pigs will sit there nice and still as they're coming through the restrainer. And then the gentleman on the end there has got the pneumatic captive bolt gun from that trailer there, which you can see the air compressor there. And then we use the 3-phase generator to power both those systems. And then as those pigs come to the end of that, they'll go ahead and the pneumatic captive bolt gun will be applied and the carcasses will slide down the chute here. So here's another one. We built it with a ramp that could fit multiple heights, or in this case, because we're already at dock height, you know, we left the ramp off and just backed it up right to the permanent loading dock and then could load the animals in there. So here you see a picture. This is of the two-step process. So as the pigs are coming down the portable V restrainer, then the person running the stunner will go ahead and stun them for about 6 to 8 seconds. And then as the pigs get to the end, that's when the pneumatic captive bolt gun is applied. And you can see here in a second, there'll be a video of that process here. So what you see here is in slow motion. So that one pig's already been stunned. He applies the pneumatic captive bolt gun while the second pig behind him is being electrical stunned. You can see as soon as the wand's off, the pig's nice and still, applies the pneumatic captive bolt gun, and the carcass goes ahead and slides down the ramp. So along with that, because while that's a two-step process, it does take more equipment to be able to do it. You know, more moving pieces means more opportunities for things to go wrong. We also did a small evaluation looking to say, well, if we change the settings on the stunner, held the contact time a little bit longer, could we make this just as a one-step electrocution? So we did do some animals like that. So in this case, no more pneumatic captive bolt gun, but the individual there will go ahead and hold the electrical stunner longer, so about 10 to 12 second contact time. And then he'll go ahead and let off as soon as that pig runs to the end of the slide. And then we went ahead and did some measurements of those animals after they came off there. So by the second time we did it, we felt really comfortable that if we had to use this tomorrow, that two-step process where we electrical stun to immobilize them, make them insensible, and then the pneumatic captive bolt gun, that was going to be something that would work tomorrow. We feel really confident about. The one-step electrical stun, that was a little more variable. We still had pigs. We check them. They would be either dead or insensible as they rolled off the bottom of it. We just saw some more post-euthanasia gasping than what we did with the other methods. So we're going to continue to evaluate that. We're looking at different wand design to get a little bit better head-to-heart contact on those. I think ultimately that is a little bit simpler and easier, and it's bloodless, so it makes it a lot easier to clean up if this is something in the foreign animal disease we want to look at going between site to site. So a little bit more work to do. Disposal methods, ones that we talk about with foreign animal disease preparation. We look at deep burial, shallow burial, grind and compost, and we also did some composting. Chris Cole, who's one of our extension ag engineers, did some composting of carcasses, and for a carbon source, he used hard pack from a beef cattle feedlot, and it actually worked really well. A couple we spent a little bit more time, which I want to talk to you a little bit more about. Shallow burial, there's a couple of evaluations going on at South Dakota State and at Oklahoma State. Kind of the advantages of shallow burial is one concern about deep burial with carcasses. If you put it in too deep of a pit and whatever virus is in there seeps into the groundwater, could potentially contaminate that, right? So with shallow burial, that's something you probably aren't going to see as much. We're only looking at 18 to 20 inch deep trench there. You put some carbon material on the bottom, you line the carcasses up, put some more carbon material over the top, and then ideally you cover it back up with dirt, and you could theoretically farm right over top of it. It's a much cheaper option too. But there's a lot of good work being done on that. Hopefully we'll have some more learnings that we can share with you here in the upcoming year or so. The other thing that we looked at, this was, we were fortunate enough, the state of Minnesota put up a couple of these grind and compost sites for producers to dispose of any carcasses that they had to do due to the supply chain disruption and depopulation. So with those, they actually take a tree grinder, and then they have to make sure they're putting equal parts compost material and carcasses in there. And We've seen it done with straw, with wood chips or corn stalks. You can estimate about 10 carcasses per minute to go through there. Or you can see on the bottom, the finalized material is put into these long windrows, and that compost material achieves about 165 degrees. Now this was done in May and June of the summer, but in just really in a matter of a couple of days. So they would generally turn those piles once, and about 30 days in, they were completely composted. There was nothing left to it. That process is a little bit more expensive, kind of depending on the cost of the carbon source and the ability to source and rent the tree grinders, but was extremely successful, certainly with that.